Hello everyone, I am Dr. Srinivasa Murthy. I am consultant neonatologist and pediatrician. In addition to that, I am the head of the department for pediatrics in Aster Women and Children Hospital, Whitefield. Today, I am going to talk about vomiting in infancy. Vomiting is a very common symptom that we see in infancy, especially in the children's age group between 0 to 1 years. Vomiting is usually seen once the baby is fed or once the baby is in lying down position. So sometimes we label these vomiting episodes as spit-ups. Most parents are concerned about these vomiting episodes, whether these episodes need to be treated or not. When we say spit-ups or vomiting, it is a spontaneous regurgitation of stomach contents into the esophagus and into the mouth. Sometimes the contents can come into the oral cavity, or sometimes it may be passed on to the nasal cavity also. This is commonly called as gastroesophageal reflux. Gastro means stomach and esophagus is food pipe. There is a valve system that connects the mouth, food pipe and the stomach, and this valve system is one way in adults. As you can see in the picture, the food goes from the mouth to the food pipe, and from the food pipe it enters into the stomach. So this is a one-way valve. In infancy, especially in the kids aged between 0 to 1 year, what happens is the food in the stomach can go from the stomach into the food pipe also. As a result of this, it becomes a two-way valve. This causes the reflux to happen in infancy. The one-way valve that is commonly seen in adults is not seen in infancy. For this change to happen, it may take 6 months to 1 year of age. As the age of the infants increase, the valve becomes more and more one way and the vomiting will come down. Most of the babies by 6 months to 1 year of age, the vomiting will subside on its own. So what needs to be done for these vomiting episodes? Most of these vomiting episodes doesn't require any treatment. Some of the conservative measures that a doctor advises for the patients are making the baby to sleep in a slanting position. Second is burping the baby immediately after feeds for 10 to 15 minutes duration, keeping the baby upright. And third thing is, in spite of these measures like slanting position or burping, the baby's vomiting may not subside. Nothing to worry if the baby is well. Treatment is required if the baby is having choking episodes, or if the baby has recurrent cough, or if the baby is not gaining weight in spite of conservative measures. Some of the treatment measures that we generally give for the babies that is rarely used are: one is thickening of feeds, antiemetics and antacids. Thank you.